Hi, this is Erin Chaney, and this is my second video for Nursing 690M, Professor Abelard. Hi there, Jenny Olston. I'm Erin, and I'm here to see you today. I'm a nurse practitioner here at the hospital, and I wanted to come introduce myself. I know you've been here for a couple of days, and talk to you for a little bit, if that's okay. Is that okay?
Mm-hmm.
All right. Can you tell me your full name?
Jenny Olston,
And how old are you?
35.
Okay. And just before we get started, I want you to know that anything we talk about today will be confidential, unless, of course, you share with me plans to harm yourself or somebody else. But other than that, everything is kept confidential. I'm going to leave my card here for you so that after you're discharged, if you need to get a hold of me for any reason, you can call this number here. And if you ever experience an emergency type situation, please don't hesitate to call 911. But for any other reasons, you can call the number here, and they'll get you in contact with me. So Jenny, can you tell me what happened? What happened to bring you here to the hospital?
I tried to kill myself. I cut my wrists.
Okay. What brought this on? Is this something that's always on your mind, or?
Mm-hmm. Yeah.
For about how long, would you say?
I don't know. Since I was a kid, teenager.
Okay.
Maybe.
Okay. Do you live with anybody?
I have 2 sons that are with me part-time.
Okay. Where are they now?
With their dad.
Okay. And it's your neighbor that brought you to the hospital?
Mm-hmm.
Okay. All right. And is she a friend of yours?
Yeah, not really. Just I know her because she lives next door and she has kids, and she's just kind of a nosy neighbor. So.
Okay. So you came in. You've been having symptoms of depression?
Mm-hmm.
And you said all your life?
Yeah, I mean as long as I can remember.
Have you had suicidal thoughts before?
Mm-hmm.
Have you attempted before?
No.
Not.
No, not really. I mean, I took a couple extra pills one time, but I chickened out, so.
Okay.
Yeah.
Okay. So you have a long history of depression. Have you been treated for it in the past?
Yeah, after I had my kids, but like growing up, it was just wasn't really recognized in my family, so
Okay.
it wasn't something we talked about, and it was just something that people who were mentally unstable had those issues.
Okay.
So.
And that was according to who?
My mom and her family.
Okay.
Yeah.
Did you have a father present in your life?
Not present.
Mm-mm. Do you have any siblings?
Mm-mm.
Okay, so you were an only child,
Mm-hmm.
and you had a single mom?
Mm-hmm.
Did she ever remarry?
Mm-mm. Nope.
Okay. Were you young when you got married?
Mm-hmm. Right out of high school.
Okay.
Mm-hmm.
And you're not currently married?
Mm-mm.
How long ago did you get divorced?
3 years now.
Okay. And has this depression worsened since then, or is it always been pretty much the same?
Yeah, I mean, it's been really bad lately, but yes, it was really bad after the divorce and right prior to the divorce too.
Okay. Have there been any other men in your life since your divorce?
Yeah, I just was seeing a guy who had some other issues, stuff going on, and I ended that recently.
Okay. And others by other stuff, was he married? Okay. And did he have a family? Okay. All right. Well, let's start talking a little bit about. We've covered kind of what's going on here. That you were you. Did your neighbor find you, or were you reaching out for help when you came, just before you came to the hospital?
Well, I had just done it, and she came over. She wanted to borrow some for a yard, and she showed up, and
Okay.
I opened the door, and she saw the blood and stuff, so.
Okay. All right. Well, thankfully she was there to help you. I'm going to ask you some questions about your previous health. As far as you know, have you ever been told that you have any other history of psychiatric illness, such as mania or psychosis or
No.
schizophrenia? Nothing other than depression? Okay. Okay. And you mentioned that you have thought about and almost committed suicide before. Have you ever devised a plan?
For committing suicide?
You said that you took a couple of pills one time. Have you ever thought out another process of ending your life?
Nothing elaborate. I've just kind of thought of other ideas, like, the just different ideas of ways that I could do it, but never a fully planned out thing.
Okay. And have you ever been hospitalized for it before?
No.
Okay. Have you sought therapy? Have you been in therapy? By yourself or with your ex-husband?
By myself.
Okay. Since your divorce?
No, well, I went like 2 times after the divorce, but she was an idiot, so I stopped going. But before that, I had gone after my first son was born, because I had some postpartum stuff, and so I went to talk with somebody.
Okay.
Then.
So you suffered from a bit of postpartum depression. Okay. All right. Have you ever been involved with any legal problems or criminal problems? Never been arrested or jailed for any reason? Okay, good. I know we talked a little bit about your family, and you mentioned that in your family it wasn't really accepted, the whole idea of being depressed. Were you around your mom a lot, or did she work a lot? Did you have a support system as a kid?
No, not really. She worked.
Did you feel like you were cared for?
No, I just kind of felt like that was my roommate.
Okay.
Who she brought the food, and she, made sure I had clothing and everything, and she didn't abuse me or anything, but she was busy. She worked a lot. She had to support the two of us, so
Yeah.
yeah.
Okay. All right. All right. Let's talk a little bit about any family history that you know of any psychiatric illness in your family. So your parents or your grandparents, any aunts or uncles?
I had an uncle who had some issues, but family didn't really talk about him.
Okay.
He just kind of was different and weird, and he wasn't around much, so I don't really know what he had because nobody talked about him.
Okay. Anybody in your family ever try to commit suicide?
He may have.
Is he still living?
No.
Okay. Is your mom still living?
Mm-mm.
Okay. All right. How did she die?
She passed away about 5 years ago from cancer.
Okay. All right. Let's talk about substance abuse. Have you had any trouble with alcohol or drugs?
I don't really think I've had trouble. I mean, as a teenager, I smoked some pot and stuff and went to parties. I mean, I drink now, but I don't know that it's really...
Are you drinking every day?
Yes. Yeah.
What are you drinking?
Usually just wine.
How much?
Maybe something a little bit harder on the weekends. On the weeknights, maybe 1 to 2 glasses. And then on the weekend, I could probably drink a bottle in a night.
Okay.
And sometimes I'll, have a couple glasses of, like, I don't know, rum and juice or something,
Okay. Are you working?
Mm-hmm.
And what kind of a job do you do?
I'm a secretary.
Okay. And are you drinking less during the week because of your job?
Yeah, but I mean, it's usually at the end of the day, it's just I need to just not think about that place, so I will just have a glass to kind of mellow out. And
Not think about that place. Is there something wrong at work?
I just don't love it.
Okay.
Some of my coworkers are gossipy and
They talk about you?
no, I'm sure. I mean, never to my face or anything, but I mean, they talk about everybody else, so
Okay.
probably.
Do you have some insecurities? Do you feel like they're talking about you? Is there something about yourself that you fear they're talking about?
Most of them are younger, in their 20s, out of college. Really into high fashion and their hair and their nails and everything, and that's not me, so I'm sure I'm that frumpy old woman sitting over there at her desk.
Okay. With regards to the alcohol consumption, did your mom drink? Or your dad? Do you know if there's any history of that in your family?
Yeah, my dad did. That's why he wasn't around, because Mom, he drank too much.
Okay.
And that was more important than his family, so...
Okay.
But my mom, she'd have wine or beer once in a while, but she was never, like, passed out drunk or anything.
Okay. Okay. All right. So we're gonna just a little review here. You have only experienced, as far as your mental health history is, depression and suicidal thoughts, and a couple actions this time, and the one time before where you took some pills. Excuse me. It sounds like you're drinking every day to kind of get away from problems.
Mm-hmm.
But you've never been hospitalized or diagnosed with any other psychiatric illness, nervousness, anxiety, any breakdowns of any sort. Okay. Well, I'm going to do a little mental status exam on you real quick. That's just going to ask you some questions to assess your orientation and things like that. So can you tell me what year it is right now?
2016.
And who's the president?
Obama.
And what state are we in right now?
Washington.
Very good. I'm going to list 3 things, and I want to see if you can remember them in a few minutes, okay? Those 3 things are a car, a ball, and a hat. A car, a ball, and a hat. Just testing your memory here, okay? Have you felt like you've got a pretty good memory, that you're remembering to do things in your everyday life lately?
Yeah.
Okay.
Yeah.
All right.
Mm-hmm.
All right. I just want to go through any other medical history you may have. So, starting with kind of go from head to toe. Any trouble with migraine headaches or seizures? Any
Migraines.
you get migraines? How often?
Not that much. Once every couple months.
Okay. And what do you use to what do you take for the pain or symptoms?
Just usually like Excedrin migraine.
Okay. All right. Any visual disturbances, problems with your hearing, anything like that?
With the migraines, I have the blurred vision.
Okay.
But outside of that, no.
Okay. Any other neurological problems? Nerve pain, anything wrong with your back?
No, excuse me. My back hurts sometimes, just sitting at the desk typing all day and not really moving much, but...
Okay. Any breathing problems, asthma, history of any illnesses there?
Mm-mm.
Are you a smoker?
Mm-mm.
Okay. Any heart disease?
Mm-mm.
Irregular heart rhythm, anything like that you know of?
Mm-mm.
High blood pressure?
No.
Okay.
There was a little bit after the divorce, but not since then, really.
Okay. Are you taking any medications for it?
For the high blood pressure?
Yeah.
No, it's
Okay.
better.
It's better, okay. Digestive tract problems, ulcers, reflux, any problems there?
No.
Okay.
Mm-mm.
Okay. Kidney infections, bladder infections, any issues there? Nothing that you are aware of. Arthritis or joint pain, other than the back pain you mentioned?
No.
Okay. Okay. Overall, any chronic or acute pain?
Mm-mm. I get normal headaches a lot, like, up here
Okay.
and back in my, just
Okay.
those kinds.
Okay. All right. And you haven't been diagnosed with any diabetes
Mm-mm.
or any other glandular things like thyroid disease or anything like that?
Mm-mm.
Have you had any surgeries recently?
No.
Okay. All right. Well, before we move on, can you remember those 3 things that I listed for you a few minutes ago?
A car, a ball, and a hat.
Good. All right. Before we wrap it up here, I want to talk a little bit about those surveys I had you fill out before we got started, and I want to kind of go over how you scored on those. The first one is called, just so I'm going to tell you the name of it. It's called the DSM-5 Self-Rated Level Cross-Cutting Symptom Measure. So it asked you a bunch of questions, and you rated things. And it really identified that you are having struggles with depression, and some somatic symptoms, so like your back pain and such that you mentioned in your headaches. And then disassociation, a little bit of maybe self-isolation, not really engaging in your community, social activity anymore. And then the second test I had you take is called the HUDAS, and it is something that kind of assesses the disability you're experiencing from your problems, and your higher disability scores fell into the areas of self-care and life activities, and then participation in society. So I think it would probably, as far as talking about a plan for the future here, I think I'm going to recommend that you be admitted to the hospital, if you're okay with this, to really try and get a grip on your depression and start some treatment and see if we can get you turned around here. There is a unit here that is for folks that have mental health problems, and I think that maybe talking with some counselors and starting on a medication regimen might help. You are not currently taking any medications other than your migraine medicine. I think you mentioned before that maybe you took depression medication in the past around the postpartum, but maybe it's time to try something new. And then, this isn't a long-term admission, but this is something that maybe we can get you going, learning some coping skills and how to get back to a normal life a little, better than what's been going on with you recently. So, so that'll be my recommendation if you're willing to stay for the treatment and try to help so there's no more suicidal ideation, and get you some skills to learn how to deal with your emotions a little bit better, because it sounds like, given your childhood and the recent years, that you haven't had an opportunity to really learn how to deal with depression. So if you are on board with that plan, we'll move forward with having you admitted. Okay. Does that sound okay? Mm-hmm. Okay. All right. Well, thank you. Mm-hmm.